Hello, all. This is Dr. Dheeraj Masapu, and in this video, I'm going to talk about a very important topic. So, medicine is a field where a lot of doctors are being produced, and everyone works very hard. And in this kind of situation, what is happening is there is a high probability that you can get replaced in future. You can get replaced in a hospital or department or your own specialty. Replacement risk is there in future because demand it's all demand supply. When more talented people are coming and who are ready to work for lesser salary, then obviously a management or a hospital or your boss would always think that it is better to replace this guy with three more talented people. That is what is happening in all the software companies and this one. Similar thing would happen in the medical also. So if you want to stay, uh, what do you call replacement proof? Okay, then you need to have eight proofs, which I'm going to tell you now. So if I have to define what exactly proof means, see, proof is not about what you think about yourself. Proof is more about what others perceive your worth is, what others perceive what your value is. So proof is more about, for example, it is more measurable and then more verifiable and what others can see of the things what you're doing. Hope I'll try to explain better in the video when I'm telling. So first proof which I would like to tell is if you have an award, for example, and like in the eight groups, there's the first one. If you have an award, like Young Researcher Award, or for example, you got the best surgical video award in a conference, that's a proof that you're doing good quality work. That means your work is being recognized in some kind of a society or a conference or anything. They carry a lot of value globally. Okay. And if these eight proofs, if you really have what I tell, then what happens is yours will be a global CV. Any country you can get a job actually, and even in India, such kind of people is what everyone wants. So number one is awards that you get, and try to get some awards, please, excellence award or some award in your hospital, in a conference or a CME or somewhere. The second proof is more about memberships in different societies. So, if I talk about membership, it is not about taking membership in ISA or a surgeons taking membership in their own particular societies. Membership is more about there should be some kind of difficulty level to enter that particular thing. For example, EDAC is a diploma, or if you want to become EDAC in anesthesia, you need to write some exams. In the same way, some kind of a fellowship that you can do in cardiology, like ESA fellowship. In radiology, you have a SAR society there, memberships would be there. So such kind of a fellowship membership in a society which is difficult to enter is what actually will carry a lot of value. That makes you extraordinary because only few people are selected right after crossing through certain examinations. So such kind of memberships carry a lot of value. Like you can in critical care, EDIC is there, and in anesthesia, the WFSI is another society where everybody cannot become a member and a few people can become. And like that, every specialty will have certain kind of memberships that you can actually do. The proof number three would be okay, more about the visibility that you get, and paper coverage and magazines also need to cover your work. See, for example, a media covers your story of our craniotomy or some kind of big, surgery you have done or a cyst you removed or something. If media covers and if your name is coming there, that's a kind of proof that you can build. And you are being interviewed by a particular news channel about fertility, or your article is coming in some kind of a stroke newspaper or something like that about some good work that you're doing. So that shows people that you are more active in the particular area. So that helps you in branding in that particular thing. So that is another proof actually. People will know and talk about you in common these kind of platforms. And next proof is you judging others' work. That means you becoming a reviewer, you becoming an examiner. Okay, you becoming and some kind of and even in a conference, if you're actually judging some kind of abstracts for posters, or you are kind of a DNB examiner, or you are a reviewer for IJ, reviewer for some kind of Asian Spine Journal, or something like that. So that carries a lot of value because you have leveled your position from submitting an article to reviewing that article. So that usually who becomes a reviewer who has submitted enough articles. So by merely having a proof that you're a reviewer, that means that you're more valuable. Okay, so that is how it is. And these four proofs I told you. Proof number five is little difficult. So innovation. Innovation means not some product. You can innovate small things like if you're a pulmonologist, like or rehab specialist, some rehab model you innovated. Or like I'm a neuro monitoring expert in anesthesia and all that. So if I invent some protocol for between anesthesia and neuro monitoring, that would be my own innovation. Or some dysphagia specialist is there if he's making a pathway for dysphagia, how to actually examine a dysphagia patient, how to treat. So something like that. If you can innovate, and then if that is coming in your name, that's a different level. But at least something you have to innovate, some protocol, pathway, or product, or something in that area, and people should recognize you. That is another proof that you're very active in that particular genre. Five proofs are our sixth proof well till now. So sixth proof is more about regular thing what I tell publications. You have to do case series, original article, retrospective studies, systematic reviews, meta-analysis, international collaboration, multicentric, whatever is possible to you, step by step you have to do and grow. And then that is a 100% proof that everyone watches. Proof number seven, okay, only two are there. Proof number seven would be you have a lead in the particular area. For example, if you're leading a stroke program in your hospital, or if you're leading, I'm leading neuro anesthesia services in this hospital, neuro intensive care. You're a lead some kind of a pediatric pulmonology clinic, or you're leading a fetal medicine program, or you're leading some vertigo clinic, or you're leading some sepsis pathways in ICU. You don't have to be a head of department. You can lead a particular path or particular program. So that is a proof that you are actually expert in that particular area. Okay. So I told seven proofs. The last proof I'm going to tell you is the proof. This is, if you ask me, then a little controversial topic, but still I will tell you. Even high income also is a proof. For example, if you're highly paid, you can't openly tell your salary, but sometimes even this becomes a proof. Like it's a proof of market validation, basically. Basically, if some kind of a center or a hospital or organization is paying you significant amount of salary, that means you are very valuable for that organization. It is a proof that you are very valuable. So you can have many intervention radiologists, cardiologists, and then some surgeons, and then anesthesiologists, intensivists who are being heavily paid. It is a proof that they are very valuable. They didn't reach that position by luck. This is another proof. So these are the different proofs actually you can actually build. And if you build your profile in this way, you'll be a global CV. And even India wants such kind of people, US wants such kind of people, and corporates want such kind of people. Australia wants such kind of people, and then even Dubai, Abu Dhabi want such kind of people. When you do these kind of things, then I didn't go into the quality audits and all those things also are there, which you can do. You can be part of so many committees in the hospital, and you even that you can. But so many other proofs are there, but these eight proofs are very important, is what I felt. And these eight proofs I have taken out from certain countries' requirements to call you extraordinary for certain. So I took out from there and I added my own experience by looking at people and made these eight proofs. So get these proofs right. It's not about what you think about yourself. You have to have evidence, more measurable evidence, what the others think about you. So that is more important, is what I feel. And so you don't become irreplaceable by luck. You become irreplaceable only when you build proofs. Okay, that is, so you become irreplaceable by design. Okay, that is what I wanted to tell. A lot of hard work is there, but if you're ready to put, you'll be able to reach that. Okay, so to close this, my mentoring is there. I think I mentored 65 people till now. So, and but there is a waiting period. If you're okay, there is a link in the description. You can enroll in that. I will, within maybe a month's time it will take for me to talk to you, but I can sit with you for a decent 1 hour and discuss all the problems that you have, and then give some solution with the knowledge that I have, and then we can come to certain kind of conclusions. And there are so many problems. Like each 65 people whom I mentored, there are 65 different stories, 65 different problems actually. So there is no common problem between two people. That is how humans are. Everyone is so complicated and complex, is what I realized after mentoring people. Okay, so thank you guys. Thank you very much for people who follow till this part of the video. Then you should subscribe to the channel and click on the bell button and all that. And uh, One thing I would like to clarify, no, see, uh, I'm not doing all these videos and all these things to earn money. I have to tell you that. So I just, charge some kind of a mentoring fees and membership fees, and with that, I can pay, salaries to some people are working for me to help in these things. That's it. That is the only intention. Because see, I don't have to earn money through all these things. I earn my money through my profession. So that is my passion, and that is where I make my money. All these things are just for hobby sake. And when I mentor people, when I talk to you like this, and actually somebody is getting inspired from the work which I do, then it excites me. That is the reason I do all these things. So don't think that actually I make some significant amount of money with that, but I make some money and I give off my salaries to some people who work for me. That is what I do. So that's about it, guys. And then thank you very much for following the video till here. As usual, Dr. Dheeraj Masapu logging off. Roger that.